Menopause is really a time period by which your hormones start to decline.
Why is it that Black women's symptoms are so much more severe?
I think it's multi-layered. I don't think that there's one answer to that. And I don't think that we actually have a definitive, oh, this is the reason. You really got to start thinking about all of the factors that influence your health before you get sick. Ideally, building your muscle, eating the right foods, getting enough movement into the day, doing the stress management work, the meditation, the breath work.
Sometimes a pairing is important. It's not just supplement and go. It is a actual 360 life change if necessary.
It isn't one pill, one medication that allows you to thrive postmenopausally. The way that I think about every single patient, when you come in, you get a very comprehensive panel of labs because I'm not looking for disease. I'm actually looking for patterns, deciding what's important to you and setting very specific goals, and then working with whoever that medical team is, whether that's your doctor, your personal trainer, your nutritionist, your therapist, to create the life you want.
The average American woman enters menopause at 52. Black women enter it at 49 and spend 3.5 more years than white women in perimenopause getting there. That is nearly a decade of your life. Your sleep, your mood, your focus, your body, all in hormonal transition. And most of us never saw it coming. Black women are 50% more likely to experience hot flashes than white women, and when they hit, they last longer. 10 years on average compared to 6.5 for white women. We have more severe symptoms. We have higher rates of depression during the transition. And Black women are the least likely of any racial group to be prescribed hormone replacement therapy, the very treatment that could help. More symptoms, less care. That is not a coincidence. That is a system. Today, I'm sitting down with Dr. Nicole Peoples, a board-certified internal medicine physician with advanced training in integrative and functional medicine and a specialist in hormone health for women. To have the conversation your doctor probably never started. This is what perimenopause and menopause actually looks like for us, and this is what we can do about it. If this is the kind of conversation you need in your life, subscribe and follow so you never miss an episode. This is the Lushness podcast. Let's get into it. Dr. Peoples, welcome to the Lushness podcast. It's really beautiful to have you here today with us.
Thank you for having me. I'm excited to talk to you.
Great. So Dr. Peoples, I want to start with something I think a lot of women listening are going to feel like in their chests. 25 years of research through the SWAN study confirmed that many Black women, what they've already lived, that we reach menopause earlier, our symptoms are worse, and we're less likely to receive treatment for them. So before we talk about hormones and biology, I need to ask you this. As a physician who specializes in this space, what is it costing Black women to go through the transition without the right support? And why is it taking this long for medicine to even take it seriously? I want to start there because I want to give women an understanding of some of the experiences they're probably going through or what they may go through. So we can start there.
Yeah, that's such a loaded question. It's got a lot of pieces to it, but I'll start with just the piece about why is this so different for Black women? And then we'll kind of talk about why is this topic just underrepresented in medical care. But particularly for Black women, we do know that we develop symptoms sooner. We also know that they tend to last longer. They tend to be more severe. And part of that, I believe, has a lot to do with our lived experiences, our stress, and our ability to adapt. I mean, our bodies genetically have one particular type of framework, but there's another part of genetics, which we call epigenetics, which is your environment's impact on your genes. So you have your genes, and all of us have like very similar genes, but we can turn those genes on or off depending on our environment. So things like our ability to get good sleep, the foods that we eat, what our microbiome looks like, which are basically the bacteria in our intestinal system, how we manage stress, how our bodies are responding to the hormones like cortisol and insulin. These are other hormones that people don't really think about that impact all of our other hormones. So part of the reason why Black women suffer for longer has a lot to do with that epigenetic factor, which is why, particularly in my practice, I don't just throw hormones at people. We also have to address the lifestyle piece of it because that piece of it has a huge impact on the way your body responds during perimenopause and menopause and beyond.
Yeah, that makes sense.
Yeah.
Looking at the whole body picture, because I know that with everything that we've covered, whole body and the experience of what we're going through with stress and environmental and food access and quality care that we have access to, all of that definitely impacts us. And it's like the word that we always use all the time, that the body is taking score all the
Yeah.
time. And that's something that, again, we're back here again, hearing this over and over again when it pertains to perimenopause and menopause. So if you could just paint a picture, tell us what it looks like when we're entering perimenopause and transitioning into menopause. I think women kind of want to hear like what that looks like,
Yeah.
and recognizing some of those symptoms so they're empowered to even speak with their physicians about it.
So I have a very specific way that I describe it, that there's the sort of classical medical definition, which I'll give you, but then I'll also take it a step further and kind of talk about what else I think we need to be paying attention to. So the classical medical definition of perimenopause is going to be that time period right before menopause where your body is starting to skip periods and you're starting to maybe have hot flashes and night sweats. And although this has been the definition that has been around for a really long time, that would be what I would consider late perimenopause. By the time you get to skipping periods and hot flashes, you are like really within that small window right before menopause being 12 months without a period. The problem with this definition is that it's incomplete, right? So basically we're thinking about perimenopause only as it relates to our cycles and symptoms like hot flashes and night sweats. And perimenopause is really a time period by which your hormones start to decline. And we know that women's hormones start to decline as early as 35. And then the question is that do you have symptoms as a result of that decline in your hormones? And many women start to experience symptoms, many of which are beyond hot flashes and night sweats, much earlier. So I usually say 35. If you're above 35 and you're experiencing any of the symptoms of perimenopause and they're not explained by something else, then I'm going to call that perimenopause. And so those symptoms can be things like depression, anxiety, overwhelmed, increase in body fat, decrease in muscle mass or muscle tone, and things like itchy ears or painful joints or difficulty with sleeping. All of these symptoms have been mislabeled as maybe their own condition, like you have insomnia or you've got depression, and we can like sort of give all of these different symptoms names. But if the etiology or the cause of this has to do with a decline in your progesterone, your testosterone, or your estrogen, then really that we should be really classifying that in the realm of perimenopause and treating it as such.
So my question is this, all of those that you just mentioned, which are super important to know as far as symptoms, why is it that Black women's symptoms are so much more severe in their journey between, perimenopause and menopause?
I don't think we have a conclusive answer to that, but sort of the types of things that I talked about before. So if you have different lifestyle factors that are influencing your overall health. So if it's affecting, again, the foods that you are eating, if those are affecting things like insulin, which is another hormone, and insulin is out of whack, that's the hormone that kind of gets associated with diabetes or prediabetes. This is just one example. So if you already have an underlying condition that would worsen your symptoms, something like diabetes or prediabetes, which we know is higher prevalence in Black women, then your symptoms may be worse. If you have issues around weight, right? And if we see those numbers are higher in women of color as well, or African-American women, that can also make things worse. But I also think this issue of cortisol or stress and held trauma is also one of those areas that is more prevalent in African-American women. And that absolutely has an impact on how you experience perimenopause and menopause. So I think it's multi-layered. I don't think that there's one answer to that. And I don't think that we actually have a definitive, this is the reason. But if you take all of those pieces and you add them up and you look at the health disparities amongst Black women, then you can pretty conclusively say that these factors are also affecting how we're experiencing a decline in our hormones.
So you would say that weathering and chronic stress kind of accelerates that a bit, or because I know that we've learned that, we're 7.5 years biologically older than other women. So I'm wondering if that's where the body is actually picking up, that we're much older. And I don't know if that's something, it would be great to kind of touch on that. Is that something that could possibly be, or?
Yeah. So just to clarify, just in case the audience isn't aware, so you have chronological aging, which is basically the number of years you've been on this earth. And then you have biological aging, which basically is sort of a comparison about how healthy you are at the age that you are. And so you can be younger or older, and that depends on a lot of factors. So, for example, if you have more chronic illnesses or you have patterns of chronic illness, right? Patterns that may be something like prediabetes, so you're leading in that direction, or obesity or hypertension or anything like that, or stress. Those sorts of things put you at higher risk and will lower your biologic age. Now, on the opposite side of that, if you have a very sort of solid diet where you're eating lots of protein and vegetables, you have optimized not just your weight, but your muscle mass, which is a really under discussed topic. But you're also managing things like trauma and stress. Those things can also lower your biological age. So you can be a 45-year-old woman who has a biological age of 38, or a 45-year-old woman who has a biological age of 52. And obviously, if you are on the higher end, then those people are going to have potentially worse symptoms. And then you add in their genetics as well.
And I'm glad that you said something about muscle mass. I was going to actually lead into like the things that impact like bone density, even our cardiovascular health, things of that nature. I want to talk a little bit about that because I don't think a lot of women also understand, they may have never had high blood pressure and all of a sudden they're seeing elevated blood pressure levels or, things of that nature. I want to talk about it because I'm in that phase right now where I'm definitely perimenopausal. So I know that sometimes I'll go in and I'll hear something new and I'm like, well, what is that?
Yeah.
I'm like, that could be from. And so that's why I want to talk a little bit more about those things, even cognitive function, the foggy brain, all of those different things that start to happen. Let's talk a little bit about that. What can we do? Like when we start to experience these type of things, what's happening in our bodies? What do we need to understand? And what can we do to kind of counteract it?
Yeah, so this is a great question specifically for somebody like me, because I practice a little bit different than what my conventional medicine had taught me how to practice, which is in conventional medicine, doctors are taught to diagnose disease, right? And if you don't have disease, you're fine. That's why you can go to the doctor and say, oh, all your labs are normal. All they're saying is that you don't have a diagnosable disease. Therefore, there's nothing that I can do, because the tool bag of tricks and things that most doctors have are really prescriptions and surgery. And so if it doesn't require a prescription, then you're otherwise healthy. Best way to approach this, and goes for your health, not just for perimenopause, is to think about what are the risk factors that are going to influence how I age. So the way that I think about every single patient, when you come in, you get a very comprehensive panel of labs, because I'm not looking for disease. I'm actually looking for patterns that actually will let me know whether or not you're going to age well, fast, or you're going to be aging slowly. And so to your question, it's not that I would wait until you had symptoms. That I would absolutely not wait till you had symptoms. We would start looking at all of these factors much earlier. And so you want to look at how your muscle mass is developing, which is why, you can actually do that using like body composition, which we do in the office. You want to look at your diet, right? So not just waiting until somebody says you need to change your diet because you're diabetes. You want to look at your diet much earlier. I mean, as early as when you're a teenager, but you want to start building habits that are going to support your body. Because what I see a lot is that people will say, oh, I was healthy until I got this diagnosis. I've been healthy my whole life. And I say, we need to really think about what we mean by health, right? You didn't have a disease, but you won't have a disease until you have it, right? But there's a time period that builds up to that. And if you're not intervening early enough, then yes, eventually this is going to lead to a disease. And if you haven't put thought to this at any point in time, like you were waiting for your doctor to give you the sign that something was wrong before you decided to act, then you were already behind the 8 ball. You really got to start thinking about all of the factors that influence your health before you get sick, ideally. But if you don't, it's not that we can't do anything once you've already hit that threshold, but it is much harder. You've got to reverse disease, which is much harder than preventing it in the first place.
That's really good. So I think pretty much what we're taking away from this is that we have to start where we are, if we haven't already, to build on a better lifestyle for our older age. And that's why weightlifting, all those things that they tell you to do, as far as preventative early, even when you don't even know why, because you're perfectly fine, you don't feel anything, you're healthy. No, now's the time to just it's like preventative is key. And if you could just do it and nothing happens, that's perfect. You're in the right place. You don't want to start doing it after something shows up and then you're
Yeah.
just like, oh my gosh, how do I reverse? Because sometimes it's hard to reverse depending on how far gone it is, but preventative is always key. And I think everything that we ever hear about always tells us, listen, you can either pay the grocer or pay the doctor. You can pay this. Or, there's always something that you have to choose. So we have to choose that lifestyle. So I really like that. I want to talk a bit about what is actually happening hormonally when we get that brain fog, when we know that estrogen is going down, it's depleting. But tell us a little bit more about what, like when we go and we talk to our doctor and we say we're going through these symptoms and they tell us something back, what is it that we should know about that?
It's actually not that your estrogen is going down. It's interestingly enough, particularly in perimenopause, what's happening in perimenopause with estrogen in particular is estrogen is going up and down. It's going through, it's like a roller coaster, right? Some months your estrogen is going to be really high, some months it's going to be low, and it's that transition period between the high and low that makes you feel really bad. And so estrogen is actually not the hormone that we treat with in perimenopause. You can use estrogen at that point, but you have to be very specific about the way you use it, because if you're using estrogen at a time when you're also still menstruating, it can cause worsening bleeding. So the hormones that are so under talked about, that are most helpful during perimenopause are going to be progesterone and testosterone. I'd also throw in there thyroid and insulin. When I think about hormones, it's not just your sex hormones, it's all of your hormones because they all play together. And if you affect one, it's going to affect the other. So you really want to look at all of those hormones. You want to look at how they're impacting each other. So progesterone is really great for sleep. So many women during this phase have difficulty sleeping. It's kind of, I don't want to say it's a joke, but I can almost guarantee that if you are above the age of 35 and you're coming to see me, that I'm going to ask you the question, how's your sleep? And then your answer is going to be, what sleep? It's something I hear all the time. And it's actually really easily treatable if the cause is low progesterone. So progesterone is going to be one of my favorite hormones in perimenopause. The other hormone that doesn't get talked about enough, and probably my favorite hormone, is testosterone. So testosterone is responsible for focus, for energy, for motivation, mood dysregulation, in addition to things like muscle mass and body composition. So testosterone is another huge hormone that can be used during perimenopause, even if your estrogen levels don't need to be treated. So this is, I think, a very common misconception. When most people say hormone replacement therapy, it's too broad. Or it's too vague. Everybody assumes we're talking about estrogen. And I'm like, I'm not even talking about estrogen. Where estrogen comes into play is typically late perimenopause or postmenopausal. So this is after you stopped having cycles. And then estrogen becomes a bigger deal. And so we start to add in estrogen at that time. So, I mean, really being able to talk about what exactly does the full picture look like? What are your symptoms? What do your labs say? What is it that your goals are, right? You have to have all three of those things to decide what the best next step is. And if the problem, let's say the problem for your sleep is sleep apnea, or the problem with your sleep is that you are so stressed that your brain is racing all day and it has nothing maybe to do with your progesterone, or maybe progesterone is a smaller piece of it, we've also got to address that, right? So really not just focusing on, this is my symptom, I need progesterone. That's how conventional medicine is. It's like a pill for an ill. You really want to say, what are my symptoms? What are my goals? What do my labs say? And is there a plan that can be put together that addresses all the issues that are affecting the way I feel?
Interesting. So that's really helpful. I love the breakdown of what each hormone does and what they're in control of. I think that's so helpful to know and empowering to understand, so that way you can put a little bit of a name to what you're feeling and what hormone could possibly be. So my question, of course, because you touched on HRT, so I want to talk a little bit about that hormonal therapy. Why is that not offered as much? And what is it that is the fear around it? I want to talk about that because there is a little bit of a stigma around hormone therapy, and I would love to break that down a little bit more and find out more about that.
if you are, depending on what age you are, you might have remembered a time when women got hormones all the time. I remember my mother had a hysterectomy very early, which Black women tend to get more often. It's that they just take out all their ovaries and everything. And I remember when my mom had her hysterectomy and they automatically put her on hormone therapy, and it was standard of care. It was one of the most prescribed drugs out there, was hormone replacement therapy up until 2002. And then something very important happened in 2002. There was a study that was released, the results of that study, which was called the Women's Health Initiative. And that study was reported as hormones cause cancer. And that is sort of the statement that went out in all media. And almost overnight, the most common drug that was being prescribed almost got taken away from just about every woman. So almost overnight, all doctors' offices that were prescribing hormone replacement therapy just stopped.
Wow.
And this has huge health implications, because the idea was that hormone replacement therapy was actually protecting women's hearts, protecting women's brains, potentially protecting their bones and their muscles. And so for the last 20 years, because of this study, women have been denied hormone replacement therapy and potentially having increased risk of these chronic illnesses that could have been prevented by being on hormones. And so what happened for those doctors who were being trained during that time, number one, the fear of God was put into them. Nobody wants to give their patient anything that they think is going to cause them cancer. And I was in medical school at this time, so I distinctly remember us just being told not to do it. So now what happens is that you go to your doctor who was never trained in hormones, who was told that they should not be prescribing hormones to their patients. And despite there being research that's come to now show that that study was misrepresented, most doctors just aren't trained.
Wow.
They don't know what to do when you come in with these symptoms, other than tell you, you'll be fine. It's just aging. You should just deal with it. Or, so many women have gone through it before you, just white knuckle it. I mean, just really insane things that we tell women.
Wow.
Around perimenopause and menopause. But I also encourage you as a patient to understand that it's not per se your doctor's fault. Okay. I would say the reason that's important to know is because a lot of patients take this hostility out, like, why didn't my doctor do something? And what most patients don't realize is that you probably have to be very savvy about getting hormone replacement in 2026. This won't be an issue, I don't think, in the next 5 years. I think more doctors are going to start to get trained. But the reality is you've got to go in knowing that your doctor may not have ever been trained. This may not be something that they have the capacity to do for you. And so you have to find specialists. So it's like you wouldn't go to let's say a psychiatrist if you need surgery. You don't necessarily are even going to go to your OBGYN if you need hormones. And that's counterintuitive to what most people think. But the moment you realize that, you stop over relying on the wrong specialty to give you the care. And I promise you, in the next decade, every OBGYN in the country will be trained in how to do hormone replacement therapy. But now it's at the discretion of those OBGYNs whether or not they're up to date on the research. And if they're not, you just have to find a different provider.
Yeah, so that you hit the nail on the head with that, because I was actually going to go into that question and ask you, what is the specialist that we can kind of look to until this process happens, where more doctors, are educated on this, or they're, a little more savvy and prone to helping? What type of specialist should we be looking for, and what type of questions should we be arming ourselves with and going into these specialists and asking on behalf of our hormones? Like, what does that look like?
Yeah, so if you really just have to find somebody who's been trained. So the classical places that you might think of would be your primary care doctor, your OBGYN, or even maybe an endocrinologist, but even less so with them. Those are the doctors who you would expect to kind of know something about it. But the issue is that because none of these specialties were ever trained, you'd have to find somebody who learned outside of medical school, right? So you would look for people who might have menopause certifications, someone who's shown interest in actually doing something with hormones. If you go to your doctor and you ask about hormones and they uniformly say, oh, I don't prescribe that, don't get mad at them. Realize that that's not their specialty and that's not where they've been trained, right? And if the larger issue could be if you ask them and they're not even willing, they don't know where to send you. That's the problem. I mean, that I think you could very well be a little bit frustrated with that provider. If you don't do this, where would I go? The other piece of it is that, nowadays, because perimenopause and menopause is such a hot topic, you can kind of Google Most women find me by just saying, Black doctor who does hormones in Atlanta. I mean, you can get very specific. I do things a little bit different. So I would say your traditional doctor who's been trained in menopause, if you are looking for that, and usually like you want someone who covers your insurance, you could go to like the sites like the Menopause Society. These are going to be sort of your conventionally trained doctors who did some training in menopause specifically. And I think that's a really great place to start. I do sometimes feel like that's incomplete just because I practice, I believe that really for menopausal care, it needs a more holistic approach than just sort of, you've got perimenopause, here's your hormone. The other place you can look for are going to be doctors who were trained more similar to me. So anti-aging medicine or the Academy for Anti-Aging Medicine, I think is the A4M is what it's called. Or I was trained through both A4M and the Institute of Functional Medicine. So these societies have been around training women on hormones since 2002. So usually you'll find doctors there who aren't new to this. They've been doing this. Then the question is, particularly if you're looking for a Black doctor, there's probably a smaller pool of women who had that or doctors that have that specific training, but it exists and it's a growing pool. So I specifically would look for a functional doctor. I'm biased there because I do think functional medicine is a more comprehensive way to address it. But keep in mind, these types of doctors usually don't take insurance, just because at that level, you're thinking about wellness, not disease. Right. And if you understand the difference, your conventional doctor is trained in disease. These other specialists are trained in wellness, and insurance does not cover that.
And that's so crazy to me because, of course, finding the root of a problem is, I would think that that's the smartest way to do medicine. You know what I mean? Especially if the labs are not showing anything. Well, let's look at the root cause and looking at all the trajectory of your life. What have you been eating? What have you been doing? What is your lifestyle, your family history? You would think, of course, you mention family history when you go to a regular doctor, of course, but to really do the root work of, exactly what's causing issues or symptoms, or even just, the labs, all that, it comes into play. So I knew you were going to say functional medicine because that's exactly where even my family, we're shifting to functional. I just think that just because the labs say everything is okay and you don't feel okay, it is good to go a little deeper. And I do understand that some folks live in medical droughts, some places where they don't have access to that care. So that leads me also to another question. Are there any natural supplements or things that we can take that help through this process? Just to help that woman that she may live in a town where there may not be a Black woman functional doctor for miles. Yeah. But, if she has these symptoms and there's just things that she'd like to just manage or it helps, what does that look like?
I'm going to answer this in two pieces.
Sure.
One is for menopause and hormone replacement therapy, there aren't really botanicals that replace your hormones, right? So often people will say, oh, can I take a nutraceutical or a supplement instead of taking estrogen or testosterone or progesterone? And my response to that is, again, all of this requires a conversation. Why do you want to do that? Why would you not want to take the hormones? Because the hormones can be quite effective and they're really the only way to get the hormones back. If you have thyroid disease, you have to actually replace the thyroid. And that's the same thing with, sex hormones. So I think that is the first piece of, if you're doing it because you're scared of hormones, well, maybe finding a doctor to talk about that. Now, with that being said, the other piece of, medical deserts at this point, now there are options that are online. I'm not against them. I don't think it's always the best strategy, but if you are looking for hormone replacement therapy to be sent directly to your house in 2026, you can absolutely have that happen at this point. So I think that's also an option because I do think it's really important for people to be on hormones if they can. And then the other sort of natural ways of approaching this aren't necessarily what people think. If you are taking sort of the conventional model, I'm having hot flashes. Is there something that's going to get rid of my hot flashes? That is still the same conventional model pill for an ill, right? And you're just replacing that pill with a supplement as opposed to what really it needs to be focused on is the entire picture. And so when I'm talking about how do you limit your symptoms during perimenopause, it's not just going to be focused on hot flashes. It's really focusing on I know people are going to say, oh, well, that's not what I'm asking, but it is really the answer. Building your muscle. eating the right foods, right? There are certain foods that can absolutely cause you to have hot flashes, certain foods that can absolutely disrupt your sleep, getting enough movement into the day, doing the stress management work, the meditation, the breath work. These are going to be your most effective ways of managing not just your hormones, but your health and your longevity. And those you can't package up. And the cheapest thing you can really do for yourself, you can't package this up in a pill, but they're more effective than you going out there and, let's say, taking, eating wild yam or soy, which is what usually people think I'm going to say to the answer to this question. Those things, their reliability or their efficacy is actually really questionable. I mean, some people I think really do get some benefits as far as their hot flashes go from maybe taking some supplements that have yam or soy in them. I think the research is not 100% conclusive in that. But I don't think that's the point. And I want to push people away from thinking, oh, I'm just going to take a supplement and somehow that supplement's going to be better, more effective, or safer than taking like a bioidentical hormone.
That's good. And I think that's always so good to hear. I know that everyone loves to go the natural route. I know that people really, really do feel good about it, but it is good to also understand that sometimes a pairing is important. It's not just supplement and go. It is a actual 360 life change if necessary, just to really give you that great longevity in your older age. So the supplements, if you stop taking it, that's it, right? But if you actually take the time to actually do the lifestyle change, do the weightlifting, do the movement, change the diet, all of that, it really does serve you in the long run. And I'm so glad that you mentioned it, because I know that even when we do, we ask some of our people that listen and we say, well, what do you want to know? Oh, we want to know about the supplements. We want to know what we should take. And I'm always like, okay, I'll ask. But the thing is that, it is good to understand that this is a lifestyle. This is not just about taking quick supplements. Our goal is to not even look at those. Our goal is to live so well that our body's doing well. Of course, we're going to need some help along the way. I'll never say that we don't need assistance along the way, but it is also good to just look at lifestyle first. What our stressors are. How do we cut back on that stress? How do we cut back on that bad food that we're eating? How do we, start to eat a little more anti-inflammatory? These are the things that really do help. So I'm glad that you said that. So tell me, Dr. Peoples, what does life look like post menopause? Like, how are women thriving? I know that it lasts for so long. And so I would love women to see what the end of the tunnel looks like. What does that thriving looks like post-menopause?
Yeah, so you're going to spend almost half of your life in post-menopause, right? So, I mean, if most women are going through menopause around 50, and if your life expectancy, God willing, is to about 90, that's 40 years of your life post-menopausally. And so really, that's the question. How do you want to live these next 40 years, right? And that really comes down to thinking about it. I do this exercise with patients called backcasting, which actually lets you think about, what do I want to look like at 90? What do I want my life to look like? What are the goal posts? Do you want to be able to get on the floor with your great grandchildren and walk around? Do you want to be pain free? Do you want to not be on medications? Do you want to be able to travel? Whatever those things are, I really want people to think about that early on. If you're 40, you need to be thinking about what you want 90 to look like. And I like you to contrast that to what you have seen. Like, what did you see in your mother? What did you see in your grandmother? What did aging look like for them? And what I find is that most people think that that is their destiny. If my grandmother could not walk because she had severe arthritis, or, my mother was in and out of the hospital or in and out of the doctor's office, like their life surrounded around what medications they took. Often, many of us think that that is sort of destiny. It's unavoidable. But once you realize that it's not unavoidable, that you actually have control over how you age, then really the work starts to, the question that you want to ask yourself is, what do I need to be doing right now so that that's what it looks like? And it isn't one thing. It isn't one pill, one medication that allows you to thrive postmenopausally. It is taking the time at whatever stage you're at right now, deciding what's important to you and setting very specific goals about what you want postmenopause to look like, and then working with whoever that medical team is, whether that's your doctor, your personal trainer, your nutritionist, your therapist, to create the life you want. And so that's a program that you're developing for your lifestyle. so that you can be, you can thrive postmenopausally. Now, the quick answer that most people are actually looking for is, what does it look like if I go on hormone replacement therapy? Well, I will tell you, hormone replacement therapy really accelerates that process, right? So I absolutely do think that there are things that we can do medically to enhance what postmenopause looks like. And most women who are on hormone replacement therapy, the thing that they say is that I feel like myself again. So I want people to know that there is light at the end of the tunnel. If you've been struggling with your symptoms, whether that's hot flashes or if it's just you don't want to get out of bed in the morning, or you just don't have the nerve to handle one more stressor in your life, that actually hormone replacement therapy takes you to that next step where you can actually regain your life again, so that you can start to implement the lifestyle behaviors that are going to actually push you not just to 50, but then to 60 and then to 70 in a way that you are still functional, you are pain-free, that you are off medications, that you are not in and out of a doctor's office. All of those things are within your realm, but it's not just because I put you on hormone therapy. It's because I put you on hormone therapy and we did all the other things.
I love it. Thank you so much, Dr. Peoples. That is exactly what we needed to hear. We need to hear that we do, in fact, have control, that we can seek out hormone therapy if necessary, and that there are plenty ways to start now, start today, to make sure your journey is A-okay, the way you need to do it, which is pretty much making sure that you can make those lifestyle changes and build the best perimenopausal, menopausal journey, because we're all going to hit it, right? Yeah. We're all going to go through it, but we do want to do it in a way that's feasible for our longevity. Thank you again.
Absolutely.